Hello, and welcome to my project today. Today, we are going to talk about the mental health of healthcare workers during the COVID-19 pandemic. COVID-19 is an infectious disease that abruptly put our world into a tailspin. This disease causes respiratory issues and symptoms that often feel like a cold or a flu, but unlike those, this will put you on a respirator or even in a coffin. Most people have started with mild symptoms and then became severely ill over time. Older adults who have certain underlying health concerns are currently at greater risk. But unlike anything that has ever came to hurt this country, we are still fighting and trying to find a way to get back on our feet. Thanks to our medical staff, the CDC, and our government, we have produced millions of vaccines to save lives and millions of healthcare workers risking their lives every day to save others. But now, these healthcare workers are taking it onto the head, dealing with these issues that will put their own lives at risk. The life saving workers are now dealing with stress, anxiety, emotional and physical exhaustion, and even worsening depression. After all the trauma and disaster these people have seen and helped us get through, it is time that we help them get through these difficult times so they can be healthy as well. Table of contents. Today, we are going to talk about what is COVID, how COVID-19 impacted the hospitals, what were the CDC's recommendations, how many healthcare workers caught COVID compared to how many non healthcare workers caught COVID, what healthcare workers were experiencing with the illness, how those experiences shaped their mental health, how many healthcare workers reached out for mental health treatment, and did the medical staff still feel supported? What is COVID 19? COVID 19 is an infectious disease caused by the SARS-CoV-2 virus, which has attacked nations, but more importantly, the respiratory system of the people themselves. The coronavirus is spread through the droplets of the virus, particles that spread when touching, breathing, and coughing near or on others, which is why the virus has spread so fast and is still prevalent in our nation today. COVID-19 impacted the hospitals and the staff. During the span of COVID-19, it has put an immense amount of stress and pressure on the healthcare workers, but the hospitals as well. The amount of patients that were entering the hospital with this disease led to shortages of healthcare workers as well as the increased burnout and exhaustion of them, which ultimately led to hospitals all over the country reporting the issue of critical shortages on staffage. While the number of ill people being admitted to hospitals was growing fast and the lack of employees available to help the patients began to fill up, these hospitals led to every space being occupied. Other patients with less severe illnesses and health concerns that would otherwise have been helped now are being left uncared for due to the concerns and lack of space in the hospitals. Nurses and doctors have to take the illness on and watch those who may have needed them be turned away. And that is draining. Being understaffed is draining. A lot of the dynamic that was very heavy compared to before the COVID-19 pandemic. What were the healthcare worker CDC recommendations? As non healthcare workers, we were expected to take a 10 to 14-day quarantine when exposed to COVID 19. But in most circumstances, asymptomatic healthcare professionals with higher risk of exposure did not require a work restriction. At least 7 days had passed since the symptoms first appeared, or at least 24 hours have passed since the last fever without any medication. Symptoms were cough, shortness of breath, and just struggling of breathing. How many healthcare workers caught COVID-19? This graph shows the difference in COVID cases from February 12th to April 9th of 2020. The dark blue is the healthcare workers compared to the non-healthcare workers in light blue. As you can see, the healthcare workers were significantly outranked. The cases of COVID in non-healthcare workers is significantly higher than those not in the healthcare workforce. Among HCP or healthcare professionals, patients who have reported having contact with laboratory COVID cases have caught it inside of the healthcare facility. The healthcare staff are not the only ones who are in danger of catching COVID-19. From first-person research, the healthcare workers that I spoke to expressed fearing for their families' lives as being a big concern as a result of the COVID-19 pandemic. The cases of COVID-19 in non-healthcare workers is significantly higher than those not in the healthcare workforce. Among healthcare professionals, patients who have reported having contact with laboratory confirmed COVID-19 cases, patients confirmed that they were mostly or majoritarily reported having contact that occurred in healthcare settings. Impacting hospitals and impacting our nurses' hearts. Since the COVID-19 has struck, there have been over 500,000 more deaths in the US. With so many hospital deaths, one can wonder how that plays effect on the healthcare's mental health. The COVID-19 pandemic has brought the safety of the healthcare professional to the forefront, even more than so with the HIV epidemic. There are so many life-saving procedures that are put on the staff. With the number of patients versus the staff, they're completely outnumbered. With no end in sight for this pandemic, the ICU or the intensive care unit practitioners, hospital administrators, and policymakers have joined hands to prepare for the surge in critical care bed capacity. Having to perform such procedures as a tracheostomy, astrotherapy, and bronchoscopy, the healthcare staff has a lot on their plates. How has COVID-19 affected the healthcare community, and what our community is doing to protect the mental health of the healthcare workers? Understanding depression. The decrease of mental health among the healthcare workers. Many healthcare workers have felt the signs of their mental health diminishing while working and providing for those during a serious pandemic that has struck the world. A lot of healthcare workers felt that they were working without the needed protective equipment or safeguards that created a sense of fearing of catching the virus and infecting their family members as well. Many of them were working long hours, night and day, while being short staffed, which led to separation from their families as well. They often were witnessing human suffering and death more than frequently due to the impact of the virus on hundreds and thousands all over the country. COVID-19 created healthcare workers to make life or death situation as something with very little information or research surrounding it. A study performed on the healthcare workers that worked directly with patients found that roughly 57% suffered from mild to severe depression, while another 57% had anxiety, and scary results showed that 1/5 of the nurses reported thoughts of self-harm or suicide. Why healthcare professionals are seeking mental health care treatment. Our studies indicate that COVID-19 had a considerable impact on the psychological well being of the forefront line hospital staff. Results suggest that nurses may be at higher risk or adverse for adverse mental health outcomes during this pandemic, with no studies to compare this group with the primary care workforce. Two studies showed that medical healthcare workers, nurses, and doctors had significantly higher of mental health risk in comparison to non-medical healthcare workers. And three studies nurses were found to be at worse risk for mental health outcomes than doctors. How many healthcare workers reached out for mental health treatment? The rate of people who have been seeking mental health treatment since COVID-19. 60% of frontline healthcare workers said the pandemic has negatively impacted their mental health. 13% of healthcare workers surveyed accessed mental health services or medication. 18% of people said they needed those types of services but didn't get them. Some of these reasons being that they felt too afraid, embarrassed, or just couldn't afford it, or unfortunately could not get the time off of work to seek the help they needed. This is alarming to learn about after knowing the study showed that 22% of healthcare work experienced some type of depression, anxiety, and post-traumatic stress disorder, and 69% of physicians reported experiencing depression, while 13 also had thoughts of suicide. First person research. For my first person research, about 10 people, 14 have responded now, but over 70% of them have felt, although they needed the mental health support, that they were not receiving any assistance from their employer. In this chart, I asked, did your employer offer any mental health care services or assistance during the pandemic? 71% said no, and I did need it, while 21% said no, and I didn't need it. What healthcare workers are saying about the pandemic effects on their mental health. What healthcare workers are saying about the pandemic's effects on their mental health. Throughout the COVID-19 pandemic, Mental Health America, or MHA, has witnessed increasing numbers of anxiety, depression, loneliness, and other mental health concerns. COVID-19 had a profound negative effect on the mental health of the nation, especially among those who are faced with combating the virus. In this chart, you will see the question, do you feel like you have adequate emotional support? 39% said no, 35% said yes, and 26% said not sure. For my first person research, I asked, did experiencing the pandemic bring extra stress to your home life? On a scale of 1 to 10, 1 being no, not at all. Oops, 1 to 5. 1 being no, not at all, and 5 being yes, very much. 50% of them stated that the pandemic brought extra stress to their home life. Why mental health of the medical staff matters. The mental health has a critical impact on the work. A study shows that when working with unresolved depression, experiences of this leads to 35% reduction in productivity. While serving and helping people, this may lead to patients being less cared for and eventually not being able to come home. Healthcare workers are the sole reason that people all over the country are still living and beating diseases every day due to the services and cares that they provide us. A poor mental health of those that provide and care for us with high quality care are less likely to do so when struggling. No one wants to be left uncared for and ignored while struggling, so it is important to remove the stigma surrounding mental health workers and their mental health. As hospitals have been short-staffed during COVID-19, it is important to see that the mental health of these staff members struggling may find themselves more likely to leave the organization, resulting even in smaller staff. All of this is important because no one wants themselves or their family members to be admitted to the hospital with no one to care for them. It is time for us to care for those who've cared for us. For my first person research, I asked, did the pandemic affect your mental health? An example, feeling burnout, anxiety, or depression on a scale of 1 to 10. 1 being no, not at all, and 10 being very much. The reason I gave such a broad spectrum on this one is because I wanted people to feel free to give medium answers and not feel so pushed to do the extreme high or low. While still 50% of people said that it significantly impacted their mental health. The pandemic was hard on us all. Treatment for healthcare workers. The NIOSH, or NOISH, is doing their part in helping the mental health of the healthcare workers in their community. With their Health Worker Mental Health Initiative, which aims to improve data and screening tools, resources, and policies to improve and address the mental health of their healthcare workers, and reduce the stigma around the idea of getting mental health, they are also working to identify workplace and community supports while also removing the barriers in order to receive the help that is needed. And after seeing the effects on COVID-19 that they had on the healthcare workers, Dr. Liao also led an effort to create a virtual support group for healthcare workers and their families to adapt to existing groups such as Project Safe Space, a program promoting resilience for emergency medicine residents, to focus on the challenges of COVID-19. Nearly 40 support groups were provided for faculty, nurse, and medical students across the healthcare system. They meet weekly, offering opportunities for reflection, grief, and community, psychoeducation, and self-care. A team of psychiatrists, psychologists, social workers, nurses, and psychiatric residents and fellows and chaplain staff volunteered to lead the sessions. If you are ever in a mental health crisis, there are people that care and want to help you. Please call or text 988 or chat at 988lifeline.org. Conclusion. In conclusion, the COVID-19 pandemic was hard for us all, but the healthcare industry was impacted the hardest. The frontline workers fought for their community and not only put their lives, but the lives of their families at risk. Their mental health is not a priority to their employers, and the results of burnout and depression were increasingly higher than ever before. The employers did not often give assistance to those in need of the mental health treatment, and so the employees suffered. Thankfully, there are online support groups and hotline numbers you can text and call when in crisis. We only wish it wouldn't have to come to a crisis for those being impacted to get the help they deserve. Overall, we failed our healthcare staff during this pandemic. Their mental health should have been more of a priority, and not only to the employer, but to the community. And this is my works cited. I quoted all my graphics and all my information separately based on which slide. Well, thank you for coming to my presentation today.